By the Spitfire of Congress, Anthony Weiner himself. No one has been a louder proponent of getting this health care plan through, and no one wants to see it passed more than in the original shape that it took when this discussion first started, including the public option. Are you disappointed that the president has come out and basically told the American people, this is what my proposal looks like, and no, it doesn't include the public option?
Well, I'm disappointed. I'm also a little bit surprised. You know, the president has said since the beginning of this process he supported the public option. It already passed in the House. The Senate, as you know, there's a growing chorus. You've reported on it that wants a public option. And in the public, it's broadly supported. So you kind of got to wonder why it's not in there, especially since the CBO says it saves us about $110 billion. It gives us choice and competition, something the Republicans say they support. So it's a little bit mysterious. You know, we learned who shot JR. I don't know who shot the public option here. So we're going to try to resuscitate it one way or the other.
Well, here's your chance to tell the American people why you think the public option is so important. The president seems to think that health care reform can do what he wants it to do, and that is cut costs for Americans and make it more inclusive for Americans. Those are the two things he really seems to want the most. He thinks you can do that without the public option. So why do you say he needs it?
Well, I think it's important because when you're going to take this big exchange that he describes, which is insurance companies, people who are uninsured get to decide which one they want to provide their coverage. They're all insurance companies, and they operate to make profits. They operate, pay out as little as they can in services, take in as much as they can. Not because they're venal or bad people, that's their business model. The public option, something like Medicare, has a different imperative. They're not looking to make profit. They're not looking for, they don't have high overhead. It's the lowest overhead of anyone providing insurance. So it would have influence on reducing the price. Whenever you have choice from a lower cost option, everyone has to compete at that lower level, and we save a lot of money to the taxpayers.
Hey, Wolf, were you taken aback at all during my interview with Barrasso that he was seemingly as headstrong as he was? Diplomatically, of course, and respectfully. You know, in the case of Congressman Joe Wilson, that tweet that I read just a little while ago, it almost sounds like Republicans are resigned just not to go along with this thing no matter what it says.
Well, they don't like it, and Senator Barrasso is one of the most knowledgeable senators when it comes to health care reform on the Republican side. He's a physician of long standing. He knows this issue about as well as anyone. And you remember last week at that Blair House Summit, he had an exchange, an interesting exchange with the president, and and the letter the president released yesterday, he mentioned Senator Barrasso by name and said, I accept your idea, so let's go forward. Obviously, that wasn't good enough for Senator Barrasso. And Senator Joe Wilson, just to remind our viewers, he's the member of the House who shouted, "You lie," at the president during that address before a joint session a few months back. So a lot of our viewers will
Anthony
remember
Weiner, Congressman Weiner, I want to get your take on this. Do you have any faith at all that you can, you or the president or Nancy Pelosi or Harry Reid can reach out to the other side on this and find some spirit of compromise, or do you think that's a lost cause?
Well, you can write this down, Rick. The Republicans don't want this to be a success. They don't want it to be a success because they're invested in the status quo. They don't want it to be a success because the healthcare industry is one of their biggest benefactors. And they don't want it to be a success because they themselves have said they want this to be the president's Waterloo. You know, the idea that President Obama and the House, Senate, and House Democrats haven't reached out. You remember we were all sitting around waiting for the Gang of Six with Republicans. We were waiting for Olympia Snowe. We were waiting for Joe Lieberman. And now, even after dozens of amendments have been included that are Republican amendments, the president includes even more. Can anyone point to a single vote that has come back our way from the Republicans? They don't want to compromise. They want to stop this.
But let me press you on that, because the point you made, in case it's lost on some of our viewers, and Wolf, of course, you can jump in here as well, what you just asserted is the following. Republicans are opposing something that may be good for the American people for two reasons. A, the money that's put in their coffers by the health insurance companies. I want to make sure I'm reading you right here. And B, the politics of losing something that the president would look good in, and they don't want him to look good. You're on the record saying here that your colleagues are willing to sacrifice good policy for the sake of money and politics. You're saying that, right,
Well,
Congressman?
wait a minute. Wait a minute. I'm not saying it. The making this President Obama's Waterloo was the Republican leadership saying it. They say it every single day. It's one of their strategic imperatives that they benefit politically if the president does not succeed. But make no mistake about it, that first part that you're treating as some kind of a news announcement, it's not. We know the healthcare industry is socked in on the Republican Party since the day one. There are people that win and people that lose in this.
Wait. Last time I checked, Max Baucus has a D in front of his name. Have you checked lately to see how much he got from the healthcare industry?
This was passed with entirely Democratic votes. You might be able to find a Democrat that got a contribution for the healthcare industry, but we voted yes to reel in the healthcare industry. The guys that voted no were trying to explain why they're doing it, and they're doing it because the Republican Party is a wholly owned subsidiary of the insurance industry. That's just the fact.
He's a Spitfire, as I said. Congressman Anthony Weiner, he's been around talking about this. My thanks to you. My thanks to my colleague Wolf Blitzer as well. And Wolf, you're going to be going all over this thing during the sit room tonight, I imagine, right?
We certainly are, Rick. It's going to be look, it's going to be a crazy next 2 or 3 weeks. But the president has already laid out the challenge. Get this done, and the leadership in the House and the Senate want it done by the Easter recess at the end of this month. So we're going to be watching every step of the way.
Anthony Weiner, Wolf Blitzer, two of the many voices you will hear as we count down to what the president had to say toward the latter half of our newscast. Gentlemen, my thanks to both of you. Hope to be seeing you again soon.
Thank you, Rick. Thank you, Wolf.
Thank you.
Here's what